Well, hello and welcome to another edition of Health Solutions with Shawn and Janet Needham, where Team Needham discusses everything healthcare. I'm your host, Shawn Needham, and I am super excited to have Teresa Alliston on our show today. We got in contact about 2 years ago, kind of talking a little bit about free market medicine. And she is a physical therapist, and I believe she is practicing in Yakima, and she specializes in pediatrics. And we're going to be talking about early intervention for infants at risk of neurodevelopment disorders. And I am going to ask her some questions today, but I probably won't put her on the spot because she's an expert in this subject. So Teresa, without further ado, welcome to our show.
Hi, how are you, Shawn?
I am doing wonderful. It's so nice to see you.
Yeah, good to see you. As you said, I'm a physical therapist. I do specialize in infants that are at risk for neurodevelopmental disorders, but I have practiced in multiple settings, from in-hospital acute to outpatient orthopedic, long-term care, and pediatrics. I have a private cash fee-for-service therapy clinic that provides services nationwide. I service patients from the day of birth. My oldest patient has been 103.
Wow.
And I do it either in person or I do it via telehealth. But one of my great passions is for those infants that are at risk of neurodevelopmental disorders.
So what is the name of your practice, Teresa?
Practice is PTOS, or Pediatric Therapy of Washington State.
Awesome. So we'll share that information a little bit later. And so go ahead and tell us, let's get into the details of, you must have a passion for neurodevelopment disorders in infants. Tell us how physical therapists can affect that.
That has changed immensely over just in the recent 10 years. There is a assessment out there known as the General Movement Assessment. And it assesses these infants with a non-invasive assessment that's used using a 3-minute video of the infant, and then the therapist looks at that video to assess the infant's movements. Because what's been found out is that that infants, even in utero, start having typical movements if their brain or their central nervous system is developing adequately and normally. If that brain, that nervous system, has been interrupted via something, a brain bleed, a lack of oxygen, infection, then those movements will not be typical. They will have abnormalities to them. And so being able to look at the infant in a 3-minute video, this assessment can be done up to about 5 months of age. After that, that window is no longer available. And so doing that assessment, we can determine if there's an abnormality in the brain, and it can even help assess, to a certain extent, the severity of that abnormality in the brain.
So should this be done with every infant?
Well, that's one of my passions. I don't know if you've seen my hashtag that says Stop CP or Stop Cerebral Palsy, but that is one of my dreams. I was thinking about this the other day, Shawn. When I was pregnant with my son, I remember being at the doctor's office and him offering me an amniocentesis. Why was he offering me that amniocentesis? To determine whether or not my fetus might possibly have Down syndrome, and then to offer me the option of an abortion. Now, this assessment will determine if your infant that is born and developing, if they are at risk of neurodevelopmental disorders such as cerebral palsy. And if so, intervention can be started immediately. So why would we not offer this assessment to every parent as an option?
Right, that makes total sense. So what is the physical therapist's role if there are abnormalities found early on?
That's another recent development that I have studied and trained in. Because of this passion of mine, I have chosen to travel around the world looking for those practitioners that I believe provide the best intervention for infants. And I located a neonatologist, Marina Solovicek, in Israel that developed a treatment for infants that are at risk of neurodevelopmental disorders. Those specifically that because of an interventricular hemorrhage or a brain bleed. And so this is one of the treatments that I offer for infants. This treatment is, again, non-invasive. It needs to start immediately within the window that I was sharing with you about up to 5 months of age, but the sooner the better. I usually start about 40 weeks, which is term, especially for the preterm and low birth weight infants. And the study that she had published in 2019 was of 4 infants that had grade 3 or grade 4 brain bleeds. Those are the most severe brain bleeds an infant can be diagnosed with. Provided this treatment, and those infants, the result was no cerebral palsy for these infants.
Wow. So of the 30 plus years I've been in healthcare, I have never heard of a physical therapist really treating infants at all, much less for neurodevelopment. So is this a fairly new phenomenon in physical therapy?
Well, not necessarily. Probably the reason you don't hear about it is because it happens in the neonatal intensive care units, right? And so a lot of those therapists aren't heard from. They're not out in the public. They're hidden behind the hospital walls, right, per se. So they do something that most people don't hear about. But this treatment, although it's been around for a long time, this neonatologist, even though the paper was published in 2019, those children were already 7 at that time. And she had developed that before the children were even born, probably 3 years before that. And so it's new, but this one is new. And probably I'm the only one that provides this treatment in the United States. She doesn't teach this in courses, as far as I know. I traveled to her hospital and trained with her for a week in order to provide the service.
So can you give us an idea of what some of the treatments are? I mean, please help educate me too, because I am really ignorant about this subject.
Yeah, well, it's a treatment that you manipulate the infant's body in the way that they should be moving instead of the way that they are moving. Their movements become very chaotic or stiff or spastic, and we don't want that to be their movements throughout life. It's hard to work and walk and play when you're stiff and spastic, but we want them to be smooth and gentle. And so we provide that movement periodically throughout the day for these infants and teach the parents how to do the same, because they're with the infants, 24 hours a day, or have a caregiver with them that can provide that. So that's in a nutshell what the treatment is, along with some other deep pressure sensations that we give them.
So you're basically in some ways trying to start muscle memory for the infants. Is that a correct way of saying it?
Yes, but more so with these infants that have had a bleed in their brain. Those neurological pathways in their brain have been interrupted. And so what we want to do is we want to maintain that muscle memory, as you were saying, while that brain bleed is resolving or new pathways are being made around that brain bleed. And so it's both. It's the muscle memory, but it's also affecting the neural pathways along with that muscle memory.
So is cerebral palsy usually caused from a brain bleed?
Well, in the United States especially, and other well-developed countries, what's being discovered throughout the world of neonatology is that infants that are preterm and low birth weight are more at risk for a brain bleed. And that brain bleed is then putting them at risk for neurodevelopmental disorders such as cerebral palsy. So infants that are preterm and low birth weight, their vascular systems are not well developed. So the stress that they might endure in life trying to be kept alive in the neonatal intensive care unit and cared for, the stress of crying, the stress of being startled, the stress of pain, all of that elevates their blood pressure. And just the elevation of their blood pressure can cause a brain bleed because their vessels are so fragile.
That makes sense. So from a pharmacist standpoint, when I think of neurodevelopment, and I might put you on the spot, and I apologize, Teresa. Remember, I'm
no,
physical
not
therapist. But when I think of neurodevelopment, I think of the importance of folic acid pre-pregnancy and during pregnancy. Is there any correlation whatsoever with folic acid and neurodevelopment and CP?
Wow. I would have to go back to my mentors, the people that I studied from, to ask them that question to find that answer for you, because I have not heard that discussion in any of my trainings, but that's a very interesting question. And I tell you, this treatment that I'm talking about, this movement imitation treatment, it only works so far with infants that have had a brain bleed. It doesn't work for infants that have had lack of oxygen, and that's the cause of their brain bleed. But we're trying to find out and develop some studies for that. So interjecting that question of the folic acid into those hypotheses for that study might be another link to finding more treatments for those infants that are at risk for cerebral palsy.
Yeah. My understanding is, folic acid is very important in neural tube development. And I don't know how if that necessarily links with CP or not.
Right. But I am right now writing that down, because that is one of my other side gigs that I do is looking into the research for these infants. So I'm going to do some more research on that, and I'll actually get back to you on that.
Yeah, I appreciate it. Yeah, I really appreciate it. So you mentioned about you are a cash practice. You don't bill any insurance. Can you elaborate on that a little bit?
Yes. So I worked for many years in an outpatient pediatric physical therapy clinic, and just came to the conclusion that I was not in that setting able to provide the best for my patients, and I couldn't walk away from work satisfied. And so now I've decided to do cash pay only. It is certainly limited the clients that I can serve. Different from physicians who can opt out of being providers for Medicare and Medicaid. Physical therapists are not allowed that by this government.
Oh, wow.
And so I have clients come to me that have payment sources through Medicaid or Medicare, and I have to tell them I can't accept their cash. It's against the law.
Right.
And so the people that I provide for through my direct pay services are people that have insurance, people that pay cash only, and now moving into the realm of those companies who choose to forego insurance and pay direct to the provider for their services, for their employees.
Yeah, there's a big move towards that because people, employers, individual patients, they've realized that the insurance makes things more expensive, the quality goes down, and the service goes down. So many times paying up front most times paying up front is a lot less expensive than going through the insurance route. Even if you have a copay or deductible, even if insurance is supposed to cover it, because your copay and deductibles are going to be more than the cash prices. That is just so often the case.
Correct. And the reason that that I see the benefits of paying cash up front and getting these services from the business that I have is that many of the services that I do for these infants, such as the movement imitation therapy and the assessment, if this can be a venue, a road to less disability in that child's life and more function, then the money outweighs, it's you won't have to pay a lifetime of money for those infants, for the medical equipment and other things that you would need if those services weren't provided.
Well, it's kind of like prevention, right?
Most definitely.
Yeah. And I mean, one thing is in our pharmacy, we specialize in a lot of health and wellness type stuff, that prevents people from getting sick. And most insurances don't pay for preventative type stuff, but they'll pay for the sick care stuff over and over and over again. And as a healthcare professional, it's just frustrating to see that. But then it's in my job to educate a patient that, look, you can pay now or you can pay a lot later. That's really the facts.
Right. Yes. And that's exactly one of the things that I promote is you pay now and get the best service and get the best results.
So this is your website. Tell us a little bit about your website. And do you treat just pediatrics or?
Once again, I treat patients from the day of birth to, as I said, my oldest patient has been 103.
Oh, that's right.
And I have many passions. My greatest passion seems to lie on either side of the spectrum. I love the infants, but I also love the geriatric patients. But I'm very athletic and active myself, so I also love orthopedic settings and situations that I deal with. And so my website mostly talks about the specialty for pediatrics, because it's one of the ways I wanted to focus in on providing those services throughout the country, but do provide services for the whole spectrum of clients from birth to however old, and do so nationwide. That's been a great opportunity that's come about with COVID, is that people are becoming very comfortable with being able to click on their screen and receive services. That's not always possible with all services through physical therapy, but when it is possible and beneficial, then I'm willing to provide that service.
So the services you've been talking and we've been focusing on, the neurodevelopment after birth, is that possible to do over telemedicine?
Yes, and that's one of the things I love about it the most. I actually have a cohort of professionals that we around the world that we interconnect and connect patients with those providers that need these services anywhere around the world. And so as I said, the assessment, the general movement assessment, is done via a 3-minute video of the infant. And I actually have an example of that if I can share my screen.
You can, even before we watch the video. So you watch a video basically to assess the patient.
Right, and that is telehealth right there.
Yeah, for sure. Mm-hmm. And then do you show the parents how to do certain exercises with the infant? Okay, that makes sense.
Yes. Yeah. So then depending on how, some parents are not comfortable, they'd rather be in person. But if they're comfortable doing it video, then they have their infant in front of them. I have my baby doll in front of me that is a replica, of their infant. And as I'm doing the treatments with the baby doll in front of me and they're watching those, they're duplicating those, replicating those with their infant, and I'm doing correction as need be.
Wow, that's super cool. And technology has really made things a lot more convenient for patients and healthcare professionals.
Yes. And I think another one of the things that is a benefit is that, most of the people that are having infants these days are techies. They're that generation that are very comfortable with technology. So it's just part of their life anyway.
Yeah. Let's see. I want to see. There it is. Tell us about this video, Allison.
Okay. So this video is of an infant that could be assessed for neurodevelopmental disorders. And you do 3 minutes just so that we can get a good length of viewing of the infant's movements. And we look at the movements and we determine if they're typical. And that's what the infant at that age should be presenting with as movements. They're very subtle. I'll tell you how subtle these movements are. When we go to training to be certified for this assessment, in the advanced training, all of the therapists are asked to bring videos of infants similar to this one, so that we have videos to assess during the training and practice. At one of the trainings, our mentor put up a video and they did the assessment. That baby looked much like this baby right here. And at the end of the assessment, the class determined that that infant was missing one fine movement in their body movements that would put them at risk for cerebral palsy, highly at risk for cerebral palsy. There was a gasp in the room from the gentleman that presented that video. And the instructor asked, why the response for the assessment of this video? He said, that video is my daughter. And I had no idea that she was at risk for cerebral palsy.
Wow.
And at that moment, the instructor said, nobody is allowed to bring personal videos to this assessment anymore.
Yeah, probably a good idea. That probably puts some fear into somebody, right?
That is not where you want to find out that your child may be at risk for cerebral palsy. Yeah.
So Teresa, tell us a little bit about this kiddo. Is everything normal in this kiddo? Are they at risk for cerebral palsy?
This kiddo is normal and is not one of my clients, just to help with HIPAA regulations. It's just a baby, Yeah. But with normal, typical development, yes.
Well, I will tell you, it's been a long time since I've had an infant in my house. But, it obviously, when you were talking about that one video that they showed in class, just looking at these infants, it can probably be hard to tell what's normal and what's not normal. From somebody that's not skilled like myself, because sometimes those infants look a little bit spastic, right?
Right.
That's why I had to ask you, is this a normal kiddo?
Right. Well, and that's it. So in the United States, there are 10 to 12,000 infants a year, or children age 8, diagnosed with cerebral palsy. Out of those 10 to 12,000, 5 to 6,000 of them had typical pregnancies, typical deliveries, no thought that there would be any issues whatsoever, until they're not walking, or they're not crawling, they're not sitting on their own, such as the first child, when you're talking about me being interested, my first child that I treated with this similar type of treatment, not knowing that I was actually doing what Dr. Slovichek was going to develop years later. This infant, I have a video that shows their progression through life, and having that treatment makes all the difference in the world.
Well, it just makes total sense. If you can catch them early when they're in that stage, rather than when they're trying to crawl or walk, right. The neurodevelopment, the muscular development is going to already be closer to normal, right? Yes. Makes total sense. But it's also, I can see how by the videos, how it's very difficult to catch it early too, because you have to have a trained eye. So that's why you went to special training to and there's probably not a lot of people that do this, because it is a very special field. It is, and that's true. So now they are starting to have people that are certified in the general movement assessment in the major children's hospitals, like Seattle, Houston, Texas, those kind of places.
But other than that, you're not going to find people that do these assessments. And certainly not people that are interested in doing them on just any child. The children usually have to show some pretty significant movements that are making them concerned about their brain development, and not something, subtle that might not possibly. And then the other thing that's being discovered is that there's a grade of brain bleed for these infants, going from grade 1 to grade 4, with grade 1 being the most mild brain bleed to grade 4 being the most severe brain bleed. And we're finding that grade 1 and 2 will sometimes resolve on their own, even without therapeutic intervention. But 2 may not resolve on its own. So if these children aren't have repeated viewing of them and their movements, and watch their progression, and you just assume that it's going to resolve on its own, the result may not be resolution. It may be a neurodevelopmental disorder.
Right. So as we wrap this podcast up, Teresa, tell us what you have a passion for.
I have a passion to see one day that there be not a child out there that has, first of all, if we could just accomplish any child that has had a brain bleed, that they receive a general movement assessment, and then they receive movement imitation therapy if they show that they are at risk of neurodevelopmental disorder. That would lead to my second passion, that no child with a brain bleed perhaps have cerebral palsy in their lifetime.
That's a hefty goal.
That's a hefty goal. And, most of my time has been spent in education. Much more time has been spent in education than in treatment. And so I would love to flip that around, and the majority of my time be spent in treatment and less in education, because most people know about it.
Yeah. Well, I'm glad you came on our podcast today. And one of the things is the goal of our podcast is to educate and empower individuals to take charge of their own health. And this is a great way to start early. If somebody needs to get a hold of you, what's the best way to do that, Teresa? I'm going to stream your website again here. Tell us what your website is. It's ptows.com?
Yes, PTOS, or for Physical Therapy of Washington State.
Okay.
The acronym for that, .com. They can go to that website. At the bottom of that website, on my main page, there is a button to click on. I have a DoxyMe telehealth, and you can get right into it. It might be on my About page, actually, if it's not at the bottom of
About or Contact?
About. Try About.
And down at the very bottom?
I think it's at the bottom of it, yeah.
Right there?
No, not the very. I'd say second to the bottom.
Okay.
Yes. So that's my DoxyMe telehealth. It gets to my office no matter what. You can click on there. You can contact me through that. You can call me on my business personal phone number, which is 509-929-0569, or contact me through the site here.
Awesome, Teresa. I love it. Thank you for doing what you do. I learned a lot. That's one thing that's so cool about our podcast, is that I learn something every time for our podcast. So I love having experts on subjects like yourself on. So thank you so much, Teresa, for being that expert.
Thank you. And thank you for doing what you do, because as I watch your podcast, I learn so much from everybody that you interview.
I'm glad to hear that. So, and speaking of podcasts, thank you, listeners and viewers, for tuning in today. Tune in Monday. Actually, it's going to be a different time. It's going to be 10 a.m. Pacific Standard Time, because I'll be flying out early in the afternoon, and we'll have Sean Casey on. He is going to be talking about sports nutrition supplements. So you don't want to miss out on that. 10 a.m. Pacific Standard Time, Health Solutions with Shawn and Janet Needham. Thank you for tuning in.